All right, welcome to The Explainer. Today, we are diving into something that, let's be honest, affects all of us: how to navigate the healthcare system with real confidence. We're going to break down a framework that's all about putting you, the patient, right in the driver's seat of your own care. Okay, let me ask you something. Have you ever been in a hospital and just felt completely lost? Like you're just along for the ride? You're hearing all this medical jargon. Maybe you feel a little too intimidated to even ask a question. Yeah, it's a feeling I think most of us know all too well.
You know that feeling, that unease? It comes from a really common place: the information gap. As patients, we're so often on the outside looking in, right? We're trying to figure out this super complex system with no map, no guide. And it's not just stressful. Frankly, it can be pretty scary.
But what if that didn't have to be the default? What if the system itself actually had a built-in guide, a standard designed specifically to close that gap, to answer your questions before you even feel lost, and to make sure your voice is actually heard? Well, guess what? There is. It's called the PRE framework, and that stands for Patient Rights and Education. And trust me, this is a really powerful standard that completely changes the game when it comes to healthcare. So PRE basically says every patient has to be treated with respect, dignity, and transparency. That's the baseline. But here's the kicker, the thing that makes it so powerful. It goes one step further. It actually mandates that you are educated. So you're not just a passenger, you're an active, informed participant in your own health journey. And this isn't just some nice-to-have idea. It's absolutely critical. Think about it. When you're empowered with knowledge, you start to trust your doctors and nurses more. And that trust, it leads to better health outcomes because you actually understand your treatment plan and you're more likely to stick with it. It's this amazing upward spiral. And it also makes sure hospitals are doing what they're supposed to do, legally and ethically. Okay, so what does this actually guarantee you? What are your specific rights here? Let's dive into the core promises of this framework. All right, you can see here how it all fits together, like 5 pillars holding everything up. It starts with your basic patient rights and the hospital's responsibility for your patient education. Then, if something goes wrong, you've got grievance redressal, a way to be heard. But the whole thing really comes alive with those last 2, informed consent and your patient participation. That's what turns you from just a patient into a real partner. Okay, let's get even more specific. First off, safe, quality care, that's non-negotiable. That's the baseline. Next, your privacy. Your medical records have to be kept confidential. And this one is huge. You have the right to be told everything, all the risks, all the benefits of any treatment. No surprises, period. And this is where your power as a patient really shines. You have the absolute right to say no, to refuse treatment without anyone trying to pressure you. It's your body, your decision. That's what autonomy is all about. And on top of that, you have the right to get a copy of your own medical records whenever you ask for them. It's your information after all. Okay, so these rights sound great on paper, right? But how does it all actually work in a real busy hospital? Let's talk about how this stuff is put into practice to actually build a better experience for you. So in the real world, it's basically a cycle. It's a loop. First, hospitals have to display your rights where you can see them. Then they have to actively share information, giving you pamphlets, talking to you. Step 3, before they do anything, they need your informed consent, using forms that are actually easy to understand. After that, they're supposed to collect your feedback, to see how they're doing. And finally, they use that feedback to train their staff better. It's a loop that's meant to just keep getting better and better. Now, let's be real. Making all this happen isn't always easy. There are definitely challenges. So let's look at some of the most common hurdles and see how the PREF framework offers some pretty clear solutions. The number one biggest hurdle? It's simple, really. A lot of patients just don't know they have these rights. And you can't use a right you don't know about, right? So the solution is just as direct. Make them impossible to miss. We're talking awareness campaigns, posters on the walls, putting the information right where you need it, when you need it. Okay, what if you do have a complaint? You don't want it to just disappear into some administrative black hole, right? Well, to prevent that, the framework requires a very clear solution. dedicated grievance redressal cells. Think of them as special departments with one job: to handle your complaints. And they have deadlines, which creates accountability and makes sure your issues actually get solved. And this is so important. Healthcare is useless if you can't understand what's being said. So for things like language or cultural barriers, the system requires real solutions. We're talking about providing translators or materials that are culturally sensitive. The whole point is to make sure that every single patient can understand and participate, no matter what their background is. So let's bring this all back to you. What does this all mean for your role in all this? Well, it's a huge shift. You go from being a passive person getting care to being an active partner in your care. This quote really just nails it, doesn't it? Empowerment isn't some fluffy buzzword. It is the absolute foundation of good healthcare. Because when you give patients knowledge and treat them with respect, the whole system just works better for everybody. So, if there's one thing to take away from all this, it's this. PR is not just a boring list of rules for the hospital to follow. Think of it as a toolbox, and it's your toolbox for empowerment. It's your license to ask questions. It's your permission slip to demand understanding, and it's your power to make the final call on your own health. And so we're going to leave you with a question to think about. The next time you find yourself in a hospital or a doctor's office, just take a look around and ask yourself, how is this place empowering me? Can I see my rights posted anywhere? Am I being treated like a real partner here? Because knowing what to look for, well, that's the first step to making sure you get the care you truly deserve. Thanks for joining us.